Hi everyone, and welcome to Webinar Wednesday. I'm your host Jessica King, and I just wanted to say a quick thank you for joining us today. For many of us, acne comes with growing up, and unfortunately the scars of acne stick with some of us too. It can be embarrassing and bring our confidence down, but luckily there is a solution to help. The solution is Fraxel. Today's speaker, dermatologist Dr. Sue-Ann Douglas, will go over how Fraxel could be the solution for you. Here's a little more info on today's speaker. Dr. Douglas is board certified by the American Board of Dermatology and the American Board of Pediatrics. She is a member of the ASLMS, American Society of Laser Medicine and Surgery. Her clinical interests include pediatric and adult dermatology, and she specializes in laser treatment of the skin. She joined Kelsey-Seybold in 2007, and she practices at the Tanglewood location. Don't forget, we'll be taking any questions you have at the end of the webinar. If a question happens to pop up, just type it into your question box and we will do our best to address it after Dr. Douglas's presentation. And now I'll turn it over to you, Dr. Douglas.
Thank you so much, Jessica. I'm happy to be here. Let's talk first about the impact of acne scars. Acne scars can have lasting physical, emotional, and psychological effects. A large percentage of individuals with acne scars feel that their scars negatively affect their self-confidence. There's several different types of acne scars, and they all are treated differently. Ice pick acne scars are the most common. There's also boxcar scars that are similar to a chickenpox scar. And there's rolling scars that give kind of a wavy appearance to the skin. And then there's hypertrophic scars that are raised, and they can even become a keloid scar. So you can see from the diagram that there's deep and rolling scars, and those are number 1 and number 2 are rolling scars. And then there's the punched out boxcar scars, which is represented by number 3. And then there's raised scars, and then 5, 6, and 7 are more the ice pick scars. So there's several different treatments for acne scars depending on the type. There's the cross technique, which I'll talk a little bit about. There's subcision, surgical removal of scars. And then my favorite way to treat scars is using the laser. And we have 3 wonderful lasers for treating acne scars, including the Fraxel Dual, Fraxel Repair, and Pulse Dye Laser. And then finally, we also sometimes will inject a dermal filler into a sunken acne scar that elevates it and makes it look much more normal. So let's talk a little bit more about our 2 Fraxel lasers, the Fraxel Dual and the Fraxel Repair. So here's a picture of the Fraxel Repair laser, and let's talk about how it works. The Fraxel lasers send little microscopic beams of laser into the skin simultaneously, and each little microscopic laser beam causes a little bit of heat damage to the skin just in that location. And how does the skin respond after it has had some heat damage? It responds by repairing itself, and it creates new skin cells and new collagen and new elastin, which essentially makes a little patch of new skin. And this process not only affects the areas that the laser beams hit, it also affects the skin around it that haven't been touched by the laser. So the overall result is that the skin is much more is repaired, and the damage has been improved greatly. So the Fraxel Dual uses this fractionated laser technology of these microscopic laser beams. It's our less aggressive laser out of the 2 Fraxel lasers. It has less downtime following a treatment, and there are more treatment sessions that are required. So it's typical for a patient to have 2 or more treatments with the Fraxel Dual. The Fraxel Repair is a more aggressive laser, and you can achieve a lot more dramatic results with 1 Fraxel Repair treatment. It also uses that fractionated laser technology. It requires usually 1 treatment, sometimes 2, And again, there's very dramatic improvement in acne scars following one treatment, but there is more downtime following a Fraxel repair treatment, usually 1 to 2 weeks. The type of laser and the number of treatments depends on the type and severity of the acne scars and the goals of each individual person. Each patient receives a customized treatment plan that takes into consideration their type of scars, their lifestyle and downtime limitations, and their budget. Fraxel Dual and Fraxel Repair laser treatments are performed in a comfortable private room at Kelsey-Seybold's Tanglewood Clinic. The actual laser procedure usually takes between 30 and 60 minutes, and most patients will spend about 3 hours here at the clinic. These are 2 patients that are being treated with the Fraxel laser. They're reclining with goggles on, and the Fraxel handpiece has kind of a rolling mechanism where the laser is rolled across the skin. This is a patient who has had a Fraxel Dual treatment, and you can see the first picture is of the patient prior to the Fraxel treatment, and then the second picture is immediately following the laser. And each day subsequent to the Fraxel treatment, the patient's face is getting less pink, and usually patients can go out of their house with makeup on 2 days after the treatment. Here's a patient that was treated with a Fraxel Dual for her acne scars, and she did have a series of 5 treatments, and she was very pleased with the improvement of her acne scars. She feels much more confident. And this is a patient prior to his Fraxel Dual treatments, and here is after a series of Fraxel Dual treatments. And as you can see, this laser is great for any skin color, so that's very nice. So it is safe on individuals with darker skin tone, patients of Asian, Hispanic, Indian, or African descent. And the question always comes up, is Fraxel laser treatment painful? We pay meticulous attention to patient comfort during these treatments. We use a number of different things to keep the patient comfortable, including topical anesthesia for about 60 to 90 minutes prior to a treatment. We also sometimes use some oral pain medication, and we have a Zimmer cooler, which gives refrigerated cool air to the skin, which makes the treatment very comfortable. Now, to talk a little bit about the other techniques that I use to treat acne scars. For rolling scars, we sometimes use subcision, and this is a simple and safe office procedure. The skin is first anesthetized with a little local anesthetic, and then a fine surgical needle is inserted into the skin and breaks up the fibrotic strands, which are tethering the acne scar to the underlying tissue. So some of these rolling scars are bound down by these little fibrotic bands, and if you release them, the acne scar just elevates. We also use the cross technique for acne scars. This is where we apply a strong acid to the small little pitted scars on the skin, and the healing process just elevates the scar very nicely and fills in those pits. We also use some dermal fillers for acne scars, including Juvederm, Restylane, and Belafil. This is a gelatinous type of material that can elevate deep acne scars. So there are lots of other things that we treat using the Fraxel lasers, including wrinkles and skin laxity, age spots, scars, stretch marks, precancerous spots, uneven pigmentation, and sun damage. And it's safe on any area of the body. Here's a patient who had a surgical scar on the cheek and wanted to improve it. And here she is after 3 treatments with the Fraxel Dual. Here's a patient who was treated for a surgical scar on the cheek with the Fraxel Repair, which is the more aggressive laser. And as you can see, she's had a nice improvement in that scar. We use the Fraxel Dual to treat a lot of brown spots and age spots, including on the hands. And this is following 2 treatments with the Fraxel Dual. She's had a nice improvement in her brown spots. Here's a patient who didn't like the brown spots and the sun damage that she had accumulated over her life, and she also wanted to tighten up some of the wrinkles. And so she had a series of several Fraxel Dual treatments and has had some nice improvement in the smoothness of her skin, the tightness, and has had a nice reduction in the brown spots. This patient wanted to improve the wrinkling and sun damage to the neck and had 3 treatments with the Fraxel Dual and has had a nice improvement in the overall youthfulness of her neck and the color and the texture and the tone. This patient has some sun damage to the backs of the hands and some wrinkling that she wanted to improve, and had 3 treatments with the Fraxel Dual and has had a nice improvement. This patient had the Fraxel repair to try to improve the wrinkles of the skin and the texture and the tone of her skin, and after 1 Fraxel repair treatment really has a very nice youthful look to her skin, a very nice improvement in the crow's feet around her eyes and the wrinkling around the mouth and the cheek area. This patient had a Fraxel repair treatment to try to improve wrinkles and the overall texture of her skin and some of the sun damage, and she was very pleased with the improvements that she saw after 1 Fraxel repair treatment. This patient had a Fraxel repair, and she was hoping to improve the under eye bags or sagging under the eyes, and she was very pleased with the improvement in her under eye circles. And again, a patient who wanted to improve on some wrinkling around her eyes and really had a very nice improvement in the wrinkles under the eyes, the crow's feet next to the corner of the eyes, and the wrinkles on the cheek. And this patient had a Fraxel Dual to reduce sunspots and freckling, and was very pleased after 2 treatments with the Fraxel Dual. So if you have acne scars, sunspots, sun damage, wrinkles, and you would like to have a consultation to inquire about your options for treatment, I would strongly encourage that you call us for a consultation. The phone number is 713-442-1111, Monday through Friday, 8 a.m. to 5 p.m. There's no need to have a physician referral, and you can learn more at Kelsey-Seybold.com/Fraxel. And I would be very happy to answer any questions that you might have. Thank you for listening.
I actually have a question that I want to get us started off with. First, those before and after pictures are amazing with the results. That was incredible. Are there any age restrictions to use Fraxel?
No, there aren't. We have 18 and 19-year-old younger patients who are bothered by their acne scars, and we treat them, and there's really no age limit. We've had 80-year-old patients who want to improve the texture and tone and tightness of their skin, so there's anywhere from the later teenage years to the 80s would be appropriate for the Fraxel lasers.
Wow, okay, that covers everyone.
So here's a question: does Kelsey Derm Doctors remove excess moles from face and neck? We do remove moles, generally not with the Fraxel lasers though. Most moles that need to be removed for either cosmetic reasons or because they look a little funny, they are still removed surgically as the most appropriate treatment. Here's another question: is Fraxel an alternative to Botox? So Botox is a substance that freezes muscles and of the face generally, and they reduce. Botox will improve the look of different wrinkles. So a lot of people have Botox to remove frown lines on the face, especially between the eyebrows and also the crow's feet next to the eyes. Botox can temporarily improve those lines, but the Botox is temporary and will last for about 3 to 4 months generally. When you have a Fraxel laser treatment for lines on the face or wrinkles, it usually is a permanent improvement in the wrinkle, and it lasts for many years. So yes, Fraxel can be used sort of as an alternative. Sometimes we use them together. Are there long-term effects to Fraxel? In terms of how long does the improvement from the Fraxel laser last, that's a great question. And a lot of patients who've had the Fraxel laser feel that their skin, that they reset the clock of their appearance to 5 or 10 or 12 years younger looking. And so the clock is sort of set back, and time marches on, and the aging process continues. And so the improvement doesn't last forever, but most people feel like it sets the clock back, and you start from that point forward. Will this procedure be offered at other Kelsey locations? The Tanglewood location is the only Kelsey location that has the lasers at this point. Our Woodlands location is probably going to be having some laser services offered there in the future, but at this point in time, just the Tanglewood location. Is Fraxel repair for facial lines a permanent result? And we just addressed that, and it's a great question. And again, it kind of sets the clock back, or turns the clock back 5 or 10 years, but the aging process continues. So most patients feel that it lasts for many years. When is too soon to start using corrective procedures like Fraxel? So some patients who are, again, in their late teenage years would want the Fraxel laser for acne scars. As far as rejuvenating the skin, generally it's patients who are in their 30s and 40s and 50s. There are some patients who want to, quote, prejuvenate their skin, increase collagen and elastin and the health of their skin even in their 20s. They try to prejuvenate to try to prevent the aging process and keep their skin looking youthful. So it is possible to use it as early as the 20s. What about this compared to V-beam? Okay, so the V-beam laser we didn't talk too much about. I do use the V-beam laser to target red things on the skin, including rosacea, spider vessels, and I treat anything red on the skin because the V-beam laser targets blood vessels and closes them off. So any unwanted redness of the skin can be treated with the V-beam. I don't use it as much for rejuvenation. It's not used for rejuvenation and tightening of the skin and wrinkle reduction. It's mostly used for reducing, reducing redness on the skin. How long is the average procedure? Usually 30 to 60 minutes for a Fraxel treatment, but because of the numbing process and the preparation time, usually patients are here for 2 to 3 hours. What is the cost for acne Fraxel treatment? How many times does it need to be done to remove all of them? So it's very variable, and every patient is going to be different, and we need to make a customized plan to best treat every patient individually. So as far as the cost, if we're doing a full face treatment for acne scars or for sunspots or rejuvenation of the skin, generally the Fraxel Dual is approximately $1,000 per treatment. And the Fraxel repair is more expensive than that. If we're doing just a small portion of the skin for a few acne scars, it would be less than that. But a full face generally for the Fraxel Dual is about $1,000. Next question, do I need to schedule a consultation first or a referral? So the phone number to call to schedule a consultation is 442-1111, and you do not need a referral from a physician.
I have a question.
Okay.
Does the patient have to prepare their skin themselves before a Fraxel treatment?
No, there's no preparation to come in and have a treatment. Generally, we ask patients to come in without having applied sunscreen or lotions or makeup on the day of the Fraxel treatment.
What about the post? Do you have to do certain things to your skin after the treatment?
Yes. So after a Fraxel treatment, especially the Fraxel dual treatment, mostly you moisturize your skin and you stay out of the sun and you use sunscreen. It's a very easy post-laser procedure after the less aggressive laser. After a Fraxel repair laser, there is some skin care. There's more weeping of the skin and a little more healing time required and a little more attentiveness to special skin care after the more aggressive laser.
You mentioned staying out of the sun. Is there a prolonged period that you can't go outside at all, or?
For the Fraxel dual, patients can be back to their normal routine and wear sunscreen, one day following the laser.
Okay.
After the Fraxel repair laser, I like them to stay out of the sun for about 2 weeks and not have any sun exposure. Okay, and another question is when Fraxel, let's see what's here. Oh, when Fraxel, when the results of Fraxel wears off, is your condition worse than before? No. So the Fraxel is creating new skin and new youthful skin with new skin cells, new elastin, and new collagen. So overall, it turns the clock back and makes your skin like it was years ago. And so that effect just improves the overall health of your skin. And yes, the aging process continues. And some patients do want to have another Fraxel dual treatment, once a year, every other year, regularly, so that their skin maintains the radiance and the youthfulness that they enjoy.
I have another question.
Okay.
Do you suggest doing Fraxel at a certain time of the year, or is it just whenever you would want to do it?
That's a great question. So we do use the Fraxel Dual year-round, or the Fraxel Repair year-round. If a patient likes to have a suntan, which we of course discourage, it's good to let the suntan fade before having a Fraxel treatment. Okay. So if a patient doesn't have a suntan, the Fraxel is fine. If they have a little suntan, I like to let it fade a little bit before we do the Fraxel so that they get the optimal benefit.
So colder months are
yeah,
better?
Right.
All right. And I know you mentioned other ways that you treat skin. So Fraxel is not for everyone, correct? So
right.
When you come for a consultation, you can say if Fraxel is going to be for you or if a dermal filler would be better.
Right.
Right? Okay.
Right. So always customize treatment plan depending on what the patient needs. And if they were to need a laser that we don't have, I would tell them where they can find the appropriate laser. So definitely we want to make sure that every patient has a very individual customized treatment plan, and it may or may not involve laser.
All right. I think that was all the questions that we had for you. So everyone, you just received some great information on how Fraxel works and could potentially help you. We hope the info was very helpful. And this concludes our webinar. I want to say a very big thank you to you, Dr. Douglas, for doing such a great job today. And of course, thanks to all of you for joining us this month.
Thank you, Jessica.
Be sure to tune in next Wednesday for our next webinar. We get 2 this month. It's Mommy Makeovers, Reclaim Your Pre-Babe Body with Dr. Jamal Bullocks. And don't forget to follow us on social media and join in on the conversation. Thanks again for tuning in, and we'll talk to you all next week.